Assalamu alaikum and good morning to one and all. In today's e-lecture tutorial, we will study about pharmacology of local anesthetic. At the end of this e-learning session, you are able to discuss pharmacological action of local anesthetics. Then you will see why local anesthetics fails to produce adequate anesthesia in inflamed tissue and use of vasoconstrictors, especially adrenaline. Let's see about pharmacological action. So the local anesthetic, the first pharmacological action, it is the local action, especially on the nerve. So on the nerve, it blocks sensory nerve ending. So sensory nerve ending, these are the nerve ending which are generally present in the sensory organs. So now if you see this image, this is the image of the skin which consists of two layers. Well, first layer it is the dermis and second layer it is epidermis. So sensory nerve ending, they are generally present in the epidermal part of the nerve ending. Likewise, there are many sensory nerve organs are there. So on superficial part of all those nerve organs, sensory nerve endings are present and they are responsible for carrying the message of the sensation. Now, since local anesthetic, it blocks sensory nerve ending, it also blocks the feeling of the sensation, or maybe the feeling in case of the skin, the sense are like touch sensation, pain sensation. So all these sensations are blocked because the local anesthetic, they block sensory nerve ending. In addition, the local anesthetic also block neuromuscular junction. These are basically neurons which are present in contact with the muscles. Since they are present in contact with the muscles, they are called as a neuromuscular junction. They also block ganglionic synapse and the receptor. So what do you mean by ganglion? So the ganglion, it is the place where many cell body of the neurons are present. So when many cell body of neurons, when they come together, the part it is formed, it is called as a ganglion. And through the ganglion, for example, this is one nerve and it carries message of the sensation. So suppose if it is coming from the nerve ending to the cell body, and from cell body it must be conveyed to other neuron. Since it blocks this ganglion as well as the synapse, that is the space between the two cell body of the neuron, due to that there is no carry forward of the message from one neuron to the other neuron. So it blocks this transmission or conduction of the impulses from one neuron to the another neuron due to blockage of the ganglionic synapse and the receptors. Whereas injection of local anesthetic around the mixed nerve. So mixed nerve means it consists of two types of nerve, sensory nerves and motor nerves. So sensory nerves, these are the nerves which actually take message from the sensory organ towards the brain, whereas the motor nerves, these are the nerves which carry message from brain to the sensory organ. For example, if there is feeling of hot sensation, so how you will feel hot sensation? So here there is involvement of the sensory nerve that carries message from your sense organ towards the brain, and then brain will respond by sending the message to remove your hand through the motor nerve. Okay, so when you are giving injection around the mixed nerve, so in such case it causes anesthesia of the skin and paralysis of voluntary muscles. This is the advantage. So or whenever you need anesthesia of the skin, or if you want to have the paralysis of voluntary muscles, you can give injection around the mixed nerve. So these are the action of local anesthetic, especially on the nerve. So it block your sensory nerve ending. Okay, it also block neuromuscular junction. It block ganglionic synapse and the receptor. Whereas injection around the mixed nerve, that is consist of both sensory and the motor nerve, it causes anesthesia of the skin and paralysis of the voluntary muscle. Okay, so this is action of local anesthetic on peripheral nerve. Next, pharmacological action, which is related to structure of fiber and how local anesthesia, it is changed with change in the structure of the fiber. So first we know that the nerve may be myelinated or it is unmyelinated in nature. The axons of these myelinated nerves, it is surrounded by the myelinated tissue, and there are some nerves where the axon it is not surrounded by the myelinated tissue. So this thick area it indicate presence of the myelinated tissue. Okay, so in such case the myelinated nerves we are blocked earlier than non-myelinated nerve. If we compare the size of the fiber, then small fibers are more sensitive as compared to larger fiber. What it means, in case of the smaller fiber, the blockage it's occur earlier as compared to the larger fiber. Whereas in case of autonomic and somatic fiber, autonomic fibers are those fibers which generally control involuntary movement or involuntary function of our body. For example, breathing. Okay. Whereas somatic fibers are those fibers which control the voluntary movement. What could be the voluntary movement? The movement of your hand. So movement of your hand it is controlled by the somatic fiber. So since it blocks first autonomic fibers, autonomic functions are first affected as compared to the somatic function. It means involuntary functions are first affected as compared to voluntary function. Next one, effect on the tongues. So we know that the tongues it's play very important role in case of sense of the taste. Okay, so the taste it is generally sensed through the presence of taste buds. Taste buds means there is presence of the taste receptors. Okay, so this receptor it feel the sensation of the taste, and due to this receptor you feel different types of taste. So there are different tastes like the bitter taste and the sour taste and sweet taste. So when you applied local anesthetic on the tongue, generally bitter taste it is first lost. So what it indicate, the receptor which is responsible for carrying message of the bitter taste, it is first blocked by the local anesthetic, and then it is followed by the loss of sweet, sour and salty taste. So this is the effect of local anesthetics on the tongue. Next, based on the location of the fiber, so based on the location of the fiber, the local anesthetic it produces first action on the proximal area. So the proximal area supplied by the nerve are affected earlier. What do you mean by proximal area? So the area which is close to the nerve. Okay, so whatever area of your body which is close to the nerve, it will be blocked first by the local anesthetic, whereas fiber which are present circumferentially means they are present around the nerves, it block earlier as compared to sensory fibers in the core of the nerve. Now suppose if there is a nerve fibers, so if these are the nerve fibers which are present, there are many nerve fibers come together and there is formation of the axon. Okay, so first it block these nerve fiber which are present in circumference. ओके जो बाहर के एरिया में जो प्रेजेंट है उसको पहले ब्लॉक करेगा एज कंपेयर टू द नर्व फाइबर विच आर प्रेजेंट इन द कोर एरिया. सो दिस इज द कोर एरिया, so it will be blocked later on. Okay, so all those nerve fibers which actually present circumferentially, these are blocked first as compared to those sensory fibers which are present in the anesthesia. This is how local anesthesia it change with change in the location of the nerve fiber. Now let's see what is the reason why local anesthetic fail to produce adequate anesthesia, especially in case of inflamed tissue. Now if there is inflammation is there, then in case of inflammation, why local anesthetic they fail to produce adequate anesthesia? Let's see the reason. So the first reason is, in case of inflammation lower the pH of the tissue. So lower pH means the acidic pH. Okay, and we know that the local anesthetic are generally they are amphiphilic in nature, means they having both lipophilic group as well as hydrophilic group. They are having both acidic group as well as basic group. Since it also contain basic group, in case due to lower in the pH, due to the acidic pH, these basic group of local anesthetic they undergo in the process of ionization. Okay, so as a result of that, the greater fraction of local anesthetic it is present in ionized form. And remember that when local anesthetic it is present in ionized form, it will not diffused into the membrane of the nerve fiber. Okay, So since it is not present in since it is present in ionized form, it will not diffuse into the membrane of the nerve fiber, and and due to that it will delay their local anesthetic action, okay, because it is present in ionized form. So to drug to diffuse across the nerve fiber or across the membrane, what is required is the drug must be present in unionized form. But what happened due to inflammation? Inflammation lowered the pH of the tissue. As a result of that, the greater fraction of local anesthetic, it is present in a ionized form. Since it is present in ionized form, it will not diffuse across the nerve fibers, and and it will delay and it will delay the block it will delay the local anesthetic action. Okay, so this is what happened when due to the inflammation. So first thing, the inflammation lower the pH of the tissue, and greater fraction of local anesthetics, it is present in a ionized form. Then next thing, in during the inflammation, we know that there is dilatation of the blood vessels, and when blood vessels they get dilate, what will happen due to that? It will increase the blood flow. So the blood flow to the inflamed area, it is increased due to the dilatation of the blood vessels, and as a result of that, local anesthetic will be removed more rapidly from the site, because we have seen in last lecture, local anesthetics are the drug which produces the local action. So specially they produces a local action. What it means, if local anesthetics are not present at the site of application, then it won't produces the local anesthesia. Now what is happening here? Due to increase in a blood supply, or due to increase in a blood flow due to inflammation, what will happen? The local anesthetics will be washed out. Okay, so local anesthetic will be removed more rapidly from the site due to the more blood supply. As a result of that, it decreases the local anesthetic action of the local anesthetics. Third thing, it also decreases effectiveness of adrenaline. So we are generally we are generally giving local anesthetic to have quick local anesthesia, but we are but what happened? But in case of inflammation, this effectiveness of adrenal injection, it is reduced at the inflamed site. Okay, since it reduce since there is reduction in the effect of adrenaline at the site of injection, as a result of that, adrenaline will not produces their action, and it reduces or it will delay the local anesthetic action. So this is the third reason. Fourth reason is inflammatory products. So there are many inflammatory products are there, like cytokines are there, then interleukins are there. So all these inflammatory products, they basically opposes the action of local anesthetic. Okay, so we have seen there are four reasons due to which due to that in case of inflammation, the local anesthetic action, it is decreased. So to summarize, the first reason is the inflammation bring down the pH, it make pH acidic. As a result of that, the local anesthetic present in ionized form, which will not diffuse across the membrane, and it will not produces the local anesthesia. Second reason, we have seen inflammation, it increases the blood flow, because inflammation they produces the dilatation of the tissue. Okay, so it increases the blood flow to the inflamed area, and due to increase in the blood flow, this blood supply will wash out, or it will remove the local anesthetic from site of action. Third reason, we have seen it reduces the effectiveness of the adrenaline which is injected with the local anesthesia, so it reduces their effectiveness. And fourth reason, inflammatory product, it opposes the action of local anesthetics. Now, as I have mentioned in earlier slide, we give the injection of the adrenaline in case of local anesthesia. Now let's see why we use the adrenaline in case of local anesthesia. So you remember that adrenaline, it is basically vasoconstrictor in nature, and this vasoconstrictor reaction, it provides many advantage to enhance the local anesthetic action. So let's see what advantage it provide. So it provide advantages like, first advantage is it prolong duration of action of local anesthetic, because what happen, the adrenaline, it produces the vasoconstriction. So there is the constriction of the blood vessels, and due to constriction of the blood vessels, there is a reduce in the blood supply at the site of action. Okay, and due to reduce in the blood supply at the site of action, it will reduces the washout, or it will not allow the blood to wash out the local anesthetic. Okay, and as a result of that, it will prolong duration of action of local anesthetic. Second thing, it enhance the intensity of nerve block, because more amount of local anesthetic it is present at site of action, so it will enhance the intensity of nerve block. Third, it reduces the systemic toxicity of local anesthetic. Okay, because drug, due to vasoconstrictive action, there will be the less blood supply, and due to less blood supply, less amount of drug will absorb into systemic circulation. Okay, and since less amount of drug it is going into systemic circulation, it will reduce a systemic toxicity of local anesthetic. Fourth one, it provides Yes. Fourth one, it provides more bloodless field for the surgery, since it reduces the blood supply. So especially the surgeon, the comfortable thing is that in case of surgeon there should be the less loss of the blood. Okay, and due to vasoconstrictor, this can be achieved by the adrenaline. What adrenaline does, it produces the vasoconstriction, and due to that it provides more bloodless field for the surgery. Let's see what the disadvantage of the local anesthesia. Let's see about the disadvantage. Let's see about disadvantage of administration of the vasoconstrictor during local anesthesia. So first disadvantage is that it make injection more painful, because it produces a constriction of the blood vessels which supply less blood. Okay, and due to that, the injection of local anesthetic, it is more painful. So this is the one of the problem with the use of the vasoconstrictor, although it having many advantage. Second, it delay wound healing, because for wound healing what is required is blood supply is required. Since vasoconstrictor that reduces the blood supply, due to that it delay the wound healing, which is related to the surgery. Third one, it also rise the blood pressure, because adrenaline, it is sympathetic in nature. Okay, and due to its sympathetic nature, it will increases the heart rate and force of constriction, which contribute to the blood pressure, which contribute to rise in the blood pressure, and it also promote the arrhythmia. So although it having the advantage, but administration of vasoconstrictor along with local anesthetic, it also having these three disadvantages. Okay, so this is all about administration of the vasoconstrictor, that is adrenaline, in along with the local anesthetic drugs. Next, let's see about the action of systemic action. So till now we have studied about the local action. Now generally we have seen the local anesthetic, they are applied for the local action. But what if the local anesthetic, they are absorbed into systemic circulation? So by chance, or most of the time at excess dose, or in case of those drugs which having high lipid solubility, they generally absorb into systemic circulation. Okay, and when they go into systemic circulation, they produces various side effect, because through blood drug will goes to different organs, and as a result of that, in addition to local action, it will also produces systemic toxicity. So let's see what are its systemic action. So depend on the concentration which is absorbed, local anesthetic produces different action on the central nervous system. Okay, so let's see what action it produces on the central nervous system. So in case of CNS, it produces the stimulation followed by the depression. So at the lower dose, local anesthetic, it produces the stimulation. Okay, at lower dose local anesthetic, it produces the stimulation, and as you increase the dose of the local anesthetic, it produces the depression. So let's see what are the symptoms which are seen. So at low dose, since it produces the stimulation of central nervous system, you see symptom like euphoria, that is feeling of great happiness. You can also see the excitement, mental confusion. So So these first symptoms are the symptom at the low dose due to the stimulation of the CNS, whereas after high dose, so as you further increase the systemic dose of the local anesthetic may causes unconsciousness, it produces the respiratory depression, and it may also lead to death of the patient. Okay, so depending upon the dose, the local anesthetic, it produces the stimulation followed by the depression. So the symptoms which are highlighted in the black text, these are the symptoms of the stimulation of the CNS, whereas the symptoms which are highlighted in the red text like unconsciousness, respiratory depression and death, it is occur at the high dose of local anesthetic, and that is due to depression of your central nervous system. So this is the effect of local anesthetic on the CNS, but it only happen when drug it is absorbed into systemic circulation. Let's see what is the action on the cardiovascular system. So the local anesthetic, they are generally cardiac depressant in nature. It means it produces the depression of the cardiovascular system. So whereas at conventional dose, local anesthetic produces no effect. So the no effects are observed at conventional dose. Only at high dose, when local anesthetic goes into systemic circulation, then only it may produces the depression of cardiovascular system. So let's see what are its effects. So they have quinidine like antiarrhythmic action, means due to depression of the cardiovascular system, what it will do, it will reduces the heart rate. Okay, and due to reduction of the heart rate, it can easily control or it can effectively control arrhythmia. Okay, so although the local anesthetic, they are used for producing local anesthesia, but some of these local anesthetic, they can be also used as the antiarrhythmic. So what you can do in for its use in case of antiarrhythmic action, you can give it systemically, means you can give the oral tablet which can absorb into blood circulation, or you can give the injection. Why? Because they are having quinidine like antiarrhythmic action. But do remember that these antiarrhythmic action, it is not present with all type of local anesthetics. It is only present with amide derivative of procaine. Okay, like we have seen there are two types of local anesthetic. One, it is ester local anesthetic, and second one, it is amide local anesthetic. So this antiarrhythmic action of local anesthetic, it is there only with amide derivative of procaine. So amide derivative of procaine, it is called as procainamides. Okay, so only this drug, that is procainamide, it is classical antiarrhythmic in nature. So due to, since it having antiarrhythmic action, it is also used systematically as an antiarrhythmic drug. Okay, so point to be remember here is not with the all drug, it is only present in case of the procainamide. Let's see what is the action on the blood vessels. So on the blood vessels, local anesthetic, it produces sympathetic blockage. So since it produces the blockage of sympathetic system, there will be the less release of the adrenaline. And since if adrenaline release, it is reduced. Yes. So if local anesthetic, it produces the sympathetic blockage, it will produces the fall in the blood pressure, because it reduces the release of the adrenaline, which is responsible for increase in heart rate and force of contraction. So if there is blockage of sympathetic nervous system, it reduces the release of the adrenaline, it reduces the heart rate, it reduces the force of contraction, and it also reduces the cardiac output, which contribute to the fall in a blood pressure. Okay, so this is one of the effect on the blood vessel, produces sympathetic blockage and it produces the fall in the blood pressure. Whereas at high concentration of local anesthetics, it produces direct relaxation of arterial smooth muscle. Okay, and due to relaxation of the arterial smooth muscle, it produces their dilatation, because there are two action on the smooth muscle. One, it is contraction, okay, and relaxation. Okay, due to contraction, it reduces the diameter of the blood vessel, whereas due to relaxation it increases the diameter of the blood vessel. Okay, so here at usual dose it produces fall in the blood pressure, whereas at high dose it produces direct relaxation of arterial smooth muscle, and both are contributing to very severe decrease in a blood pressure. Okay, so when such things are happen, when there is very severe decrease in a blood pressure, it is produced due to the local anesthetic. At toxic concentration of local anesthetics, it produces cardiovascular collapse, means it decreases the blood pressure. And we know that for normal functioning of your the heart, what is required is blood pressure. Normal blood pressure is required. Since it reduces the blood pressure, it produces the relaxation of the arterial smooth muscle. At very toxic concentration of local anesthetic, it produces cardiovascular collapse. So it is dose dependent action. At low dose it produces, so to summarize, the local anesthetic produces dose dependent action on the cardiovascular system. At low dose it produces the blockage of sympathetic system, which lead to a decrease in a blood pressure. At high dose it produces relaxation of the smooth muscle. Okay, and at toxic concentration of local anesthetic it produces complete cardiovascular collapse. So we can see now the local anesthetics, when they absorb into systemic circulation, they produces very severe effect. So we have done with today's session. Now let's start with question and answer. So my first question, it is to Ashab Faruqi. I hope Ashab you are listening to me. So my question is, recommend site of injection for anesthesia of skin and paralysis of voluntary muscle. Recommend site of injection for anesthesia of skin and paralysis of voluntary muscle. So where we are giving the injection of local anesthetics. If we want anesthesia of skin and paralysis of voluntary muscle. So we are selecting special type of nerve here. Question, it is open to audience. You can also give the answer. If Asab is unable to answer, you can give the answer. Yes. Aksa given the answer, mixed nerve. Nurun Nisa, mixed nerve, right? So the mixed nerve which consists of both sensory as well as motor nerve. So when we give the injection of local anesthetics, especially in case of mixed nerve, it will block both sensory as well as the motor supply, and it produces very good anesthesia of the skin and paralysis of the voluntary muscle. My next question, among myelinated and non-myelinated fiber, which one blocked first by local anesthetics? Among myelinated and non-myelinated fiber, which nerve blocked first by local anesthetics? Yes, I am waiting for answer. Anyone can give the answer. Yes, so Nurun Nisa given the answer, myelinated. Ikra, Abdul Hafiz, very good. Yahya, Aksa, Altaf Siddiqui. Yes. So it is myelinated nerves. So myelinated nerves blocked first by the local anesthetics. My next question is, what can be done to prolong duration of action and reduce systemic toxicity of local anesthetics? So what can be done to prolong duration of action and reduce systemic toxicity of local anesthetics? Yes, so Shahnwaz given the answer, we will give vasoconstrictor, adrenaline injection will give. Then Aksa Kazi has given the answer, vasoconstrictor, adrenaline, very good. Nurun Nisa, some of the students they are active, but others I am expecting answer from others also. Yes, so it produces the we are giving vasoconstrictor if we want to prolong duration of action and reduce systemic toxicity of local anesthetics. My next question is, what is the effect of increase in blood flow due to inflammation on the action of local anesthetics? So what will happen due to increase in a blood flow due to inflammation on the action of local anesthetics? Yes, I am waiting for answer. Come on, what will happen due to increase in a blood flow due to inflammation? Yes, very good. Dabir given the answer. Due to inflammation, there will be increase in a blood flow, and as a result of that, this blood, along with the blood, local anesthetic will remove from site of action. Okay, so it is not. I am not expecting answer on the blood pressure. Actually, it produces the action on the, which is related to removal of the drug from site of action. Okay, so due to increase in a blood, Saqib Sayyed has also given the right answer. They are removed from site of action. Okay, Ikra Hussain given the right answer. Rafiq Sayyed given the right answer. Sheikh Tanaza right answer. So local anesthetic, they will be removed from site of action. My last question is, name local anesthetic with antiarrhythmic action. Name local anesthetics with antiarrhythmic action. Yes. We have seen only few local anesthetic having this action. Which, yes. So Nurun Nisa given the answer. It is prokenamide. So the prokenamide, it is only local anesthetic with antiarrhythmic action. It is the amide in nature. Okay, so nice. I hope there is some connectivity issue today, so in between might be the lecture is not flawless or buffering was there, but later on it is good. I think you have got what I have taught in today's lecture. Okay, so thank you very much. So I have done with my session. Give me a time, I am releasing attendance link.